Hi there, I'm Amy, and this is Hospice 101. Today we're talking about what hospice care actually is, because there's a lot of confusion out there and some pretty big misconceptions. So let's start with the basics. Hospice is specialized medical care for people with a life-limiting illness who have a prognosis of 6 months or less. But here's what's really important to understand. Hospice isn't about giving up. It's about shifting the focus. Instead of continuing to try to cure the illness, hospice focuses on comfort, pain management, and helping you live as well as possible. It's comprehensive care for both the patient and the family. Now, you might be wondering, how do people actually get connected to hospice in the first place? Usually it starts with your own doctor, your primary care physician, or a specialist. Even a hospital discharge planner can refer you to hospice. But here's something else you need to know. You can also call a hospice provider directly. You don't have to wait for someone else to bring it up. And your own doctor? If you enroll in hospice, they stay involved in your care. The hospice team works with your existing medical team, not instead of them. Your doctor will work with the hospice medical director to make sure your care plan is exactly right for you. Now, here's something that surprises a lot of people. Hospice isn't just for the final days or weeks of life. Medicare actually provides hospice benefits for up to 6 months, with unlimited extensions if you continue to qualify. The goal is to help you feel better and live more comfortably, for whatever time you have. And research shows something amazing. Patients who start hospice care often live as long or even longer than those receiving more aggressive treatments. So what does hospice care actually include? Well, you get an entire team of specialists. Your hospice doctor focuses on comfort care and symptom management. Skilled nurses visit regularly and are available 24 hours a day. Social workers help with emotional support and practical needs. Chaplains provide spiritual care. And trained volunteers offer companionship and special services. Here's another thing people often don't realize. Most hospice care happens right at home, whether that's your house, an assisted living community, or a comfortable private room in an adult care home. The goal is to keep you comfortable in familiar surroundings, surrounded by the people you love. When needed, there's also inpatient care available for managing complex symptoms or giving your family caregivers a break. And here's something really important. You are always in control. If you decide hospice isn't right for you, or if you want to try curative treatments again, you can change your mind at any time. You can stop hospice care and return to regular medical treatment. It's your choice. And you have the right to make different decisions as your situation changes. When families choose hospice, they often tell us they wish they'd started sooner, because hospice gives you something precious. Time to focus on what matters most. Time with family. Comfort from pain. Support through difficult emotions. And help navigating one of life's most challenging journeys. The research consistently shows better quality of life, better family satisfaction, and often, better outcomes overall. Of course, you might be wondering about cost. Here's the good news. If you have Medicare, hospice is almost entirely covered. No big medical bills, no expensive treatments that may not help. In fact, choosing hospice often saves families thousands of dollars, while providing much better care and support. Look, deciding about hospice care is never easy. But understanding what it actually is can help you make the best decision for your situation. Hospice isn't about giving up hope. It's about hoping for comfort, dignity, and meaningful time with the people you love. If you have questions about hospice care or want to learn more about your options, please reach out to us at EverLight Hospice. We're here to help, with honest answers and compassionate support, because everyone deserves to understand their choices.